Back in March 2010, Congress passed President Obama's health care reform legislation. The proposal made health coverage available to many more Americans while taking some initial steps to bring down medical costs in the years ahead. But opponents of Obama's health care reform gained strength in the November 2010 elections and began fighting to reverse major parts of the reform. With so much controversy, it's almost impossible to predict how our country's healthcare system is going to turn out in the long run. So in January 2011, we approached this complex issue by talking to two primary care physicians in New York. Our goal? To see what the economics of practicing medicine look like from the perspective of doctors.
My name is Dr. Ken Redcross. I'm a practicing internist, specialized in internal medicine. I also practice a form of concierge medicine, or what I like to call personalized medicine as well. Gosh, I've been in medicine for years, but as far as a practicing internist, for 10 years actually. I had a scholarship for the National Health Service Corps because I wanted to work in an underserved area. So I worked out in Oxnard, which is an area where I took care of migrant farm workers from Mexico. In any case, it allowed me to kind of do the service that I always loved. And I did that for 4 years actually. But I'm a city kid at heart. So after those 4 years, I decided I want to get into a little bit of a bigger city. And so that's when I ended up going to Beverly Hills and practicing there.
Any people that I might know that you've treated along the way?
Sure. I deal with a lot of folks in the industry, whether it be on the sports side or whether it be on the acting side or that sort of thing. So I deal with a lot of people who are, I guess you would say in the public eye, who appreciate the access that's provided by myself.
My name is Dr. Erie Agustin, and I'm from the Philippines. I graduated in 1980. I've been doing emergency room for almost 20 years, and started my general practice about internal medicine about 6 years ago. So I'm now in Queens, taking care of general medicine, internal medicine practice.
What inspired you to go from doing emergency medicine to starting your own practice?
After I finished my residency, I was doing moonlighting in ER, emergency room, and I realized that that's what I like to do. And I did it for almost 20 years. And but as you get old, I mean, it's not so easy to be working like 12 hours straight nights. It's for young people. So 5 years ago, I decided to start my practice, and I quit ER maybe a year from now. So I'm now doing a full-time internal medicine practice.
It's hard as a solo practitioner. You know, I'm blessed because I'm in a group and then I have my own business or practice on the side. But it'd be very challenging if you wanted to do that on your own.
Running an office is, you learn it as you go on. It's like in medical school, they usually don't teach you the economics of medicine. All they teach you is how to treat patients. But in real life, you have to be a accountant also. That's why I have to work in several places. I have to do some moonlighting to survive. I mean, that's the reality. I mean, if you spend $150 an hour without your salary, and then insurance company pays you only 60% of how much you spend, and that's even more difficult than treating somebody with trauma, chest pain, pneumonia. That's easy.
Do you feel there's an increasing amount of restrictions on doctors when it comes to how they practice or how they get income from their practice?
It definitely is. I think a lot of that is based on one word: volume. It's the volume of patients that doctors are asked to see and the amount of time. And I think even if you're getting different fee structures, I think it's still about volume. You're still feeling very overwhelmed with the amount of patients that you're asked to see and be able to kind of make the bottom line.
Everybody's quiet about it, but we are having a crisis now. Doctors are closing their office. I mean, doctors retire early. Some doctors could not afford to pay their malpractice, so it comes to the point that they have to, I know a doctor, he quit because it comes to the point that he has to get his retirement money to pay his malpractice because he's not getting enough revenue from his practice.
Whenever I'm dealing with the concierge medicine type of patients, I mean, usually it's a cash practice. It's not covered by insurances. So by all means, it definitely is a way to supplement your income and supplement what you do. But like I said, for me, you know, you can supplement yourself financially, but it just supplements me emotionally for the way I like to deliver care and for the type of medicine that I enjoy and the reason why I went into healthcare in the first place.
Mm-hmm.